As a health physicist in a medical center, my primary duty is to maintain our Nuclear Regulatory Commission license. This license allows us to use radioactive materials for medical studies which help our physicians diagnose various medical conditions. To maintain our license, there are 5 basic program areas. The first program area is surveys for contamination. My staff is responsible for doing weekly surveys for radioactive contamination to ensure that we are using radioactive materials in a safe and reasonable manner. These surveys involve sweeping an area with a pancake probe to identify hotspots, where we then take swipes to analyze for removable contamination. We also take exposure readings to determine the ambient radiation in an area or at a hotspot. The second program area is handling radioactive waste. As part of our operations, our hospital produces some trash that contains radioactive materials. These trash items can be anything from contaminated chucks, used syringes, IV lines, or soiled linens. The materials we use have very short half-lives, so since the hospital has already designated waste streams for items of these types, our management of the radioactive waste is really rather like a beaver dam and less like a diversion. We don't dispose of radioactive items. We simply hold them in storage until the radioactivity is undetectable, and then we release them back into their natural waste stream. The third program area is keeping track of radioactive sources. Part of running any operation is quality control. To conduct the QC on the instruments and cameras we use in nuclear medicine, our hospital possesses some small radioactive sources. Each source has a serial number and we inventory them regularly. Some of the sources get leak tested to ensure their continued integrity. The fourth program area is radiation therapies. Sometimes we get a patient that needs radiation therapy for cancer or some other condition. At our hospital, we don't have any radiation therapy equipment, but we do have the capacity to dose patients with radioactive iodine to treat for thyroid cancer. Our thyroid cancer patients are given an isolated room and generally stay anywhere from 2 to 4 days. The final program area is keeping track of radiation exposures. Our dosimetry custodian is responsible for issuing dosimeters to all of our radiation workers. These dosimeters are worn for either 1 month or 3 months and then exchanged and sent off for processing. In return, we receive a printed report detailing what exposure each badge recorded for the worker who wore it. This information allows us to monitor our workers and give them feedback about their work practices and find ways to better protect them. Apart from our licensed activities, we also monitor our employees who work with X-ray machines, and we have a program for laser safety as well. One of my duties is to ensure that each X-ray machine in the hospital is checked yearly. This check is to ensure that what the machine says it's doing is what it is actually doing. We do this by checking the machine's output with a non-invasive detector which analyzes the radiation beam and gives us some feedback about the beam's attributes and quality. On the laser side, we do a yearly audit of each department that has a laser to ensure that we have all the proper safety equipment, safety procedures in place, and that each worker has been through the proper occupational screening. There are other case-by-case duties that I take care of as well. For instance, when there's a new construction or a modification to an existing clinic, I can do a shielding calculation so that the construction contractor knows how much lead to put in the walls. And then I can also go down to the construction site and do an inspection to ensure that the lead was actually put in place. It's really these non-routine tasks that make this job very interesting. The part of the job I enjoy the most is education. I am constantly available to the staff of my medical center to answer questions, provide input and advice, give classes. And by being the local technical expert on radiation safety, I have a direct impact on the well-being of our patients.